Hello friends, welcome back to Complete Medical Coding. Today I am here with few important mock questions. Okay, mock questions from the 40,000 series. That is digestive system. Okay, so as you know 40,000 series, it's the digestive system starts from 40,000 series. Okay, so let's discuss today some important guidelines and mock questions from the digestive system. Okay friends, so before moving to the video, if you are new to the channel, please support me by subscribing to the channel. So let's move to the questions. Let's discuss the questions one by one. First question: an 84-year-old female had a CAT scan which revealed evidence of a proximal small bowel obstruction. She was taken to the operating room where an elliptical abdominal incision was made, excising the skin and subcutaneous tissue. There were extensive adhesions along the entire length of the small bowel. The omentum and bowel were stuck up to the anterior abdominal wall. Time-consuming tedious lysis of adhesions was performed to free up the entire length of the gastrointestinal tract from the ligament to trace to the ileocolic anastomosis. What is the correct CPT code? Okay, so you have to code. We have to code the CPT code for the adhesive, the tedious lysis of adhesions. Time-consuming tedious lysis of adhesions was performed. So that's the service, the procedure that was carried out. Okay, time-consuming tedious lysis of adhesions was performed to free up the entire length of gastrointestinal tract. All right, so let's move to the options, the CPT codes. Let's check the CPT codes one by one. And from that, we have to find out the correct CPT code. Okay. So just open your CPT code book and go to 40,000 series, the digestive system. Go to the first CPT code, 44005. What is 44005? Enterolysis. 44005 is enterolysis, freeing of intestinal adhesion, separate procedure. So, freeing of intestinal adhesion, gastrointestinal adhesion, gastrointestinal tract, separate procedure, enterolysis. Let's check all the options, okay, all the CPT codes. What is the next one? Option B, 44180. What is 44180? Laparoscopy. Laparoscopy surgical enterolysis. Freeing of intestinal adhesion, separate procedure. Laparoscopy. So here it is not laparoscopy. Nowhere it's mentioned that this is a laparoscopy procedure. That is a wrong code. Again, option C, the same CPT code, 44005 with modifier 22. And option D, 44180, again laparoscopic code with modifier 59. So we can skip options B and D because it's laparoscopic code, right? So as discussed earlier, the correct CPT code is 44005 only as the first code, 44005. So if you check options A and C, you can see in option C, it is appended with a modifier 22. So you have to check what is modifier 22. You should know what is modifier 22. Modifier 22. Modifier 22 means the modifier 22 is used to reflect additional work that is not typically part of the procedure but does not qualify for its own procedure, its own procedure code. Okay. So modifier 22 is added to reflect the additional work which is not a part of the procedure. Some additional work, some additional procedure or some additional part that is not a part of the current procedure. So in that case, we will add modifier 22. So here actually what is the procedure carried out? The patient had a CAT scan okay, because of the small, the obstruction, the bowel obstruction. And then she was taken to operating room where elliptical abdominal incision was made. Abdominal incision was made through excising the skin and subcutaneous tissue. Then they had seen so many extensive adhesions along the entire length of small bowel. Momentum and bowel were stuck up to the anterior abdominal wall. Time-consuming tedious lysis of adhesions was performed. So here tedious lysis of adhesions means freeing of the intestinal adhesions was performed, which is a separate procedure. Okay, so freeing of adhesion, freeing of the time-consuming tedious lysis of adhesions was performed to free up the entire length. Okay, so this is a separate procedure because for freeing up of what do you call it? The adhesions, the intestinal adhesions is a separate procedure, which is not a part of the excision that they had carried out. Excision of by excising skin and subcutaneous tissue, the physician has made an abdominal incision to check what is the bowel obstruction. Okay, so in the while doing that, the physician has seen so many adhesions in the intestine. So they had freed up that adhesions, right? So which is not a part of the procedure, but it is a procedure that you have to complete it while doing the current procedure. It is also important to do that procedure. So in such cases, you have to append it with modifier 22. Okay. So here you have to mark it with modifier 22. So the correct answer will be option C, the CPT code 44005 along with modifier 22. So option C is the correct answer here. Okay. Hope you understood. If you have any queries, you can mark it in the comments. And there is one guideline here. Laparoscopic lysis of adhesions. The CPT code 44180. The options, which are that options? Options B and D. Yeah. 44180 is the laparoscopic enterolysis, right? So this laparoscopic lysis of adhesions is not separately reportable with other surgical laparoscopic procedures. So it means if there is any other procedure, any other laparoscopic procedure carried out, okay, you should not bill the CPT code 44180 along with some other laparoscopic procedure. That's what it means. It should be either 44180 or 58660. What is 58660? You can go and check what is 58660. 58660, it will come in 58660. Yeah, it will come in under the reproductive system, genital system, female genital system. 58660. Again, laparoscopy surgical with lysis of adhesions. It's the same. Salpingolysis or ovariolysis. So these two codes, laparoscopy with lysis of adhesions for salpingolysis or ovariolysis, or this 44180, that is enterolysis. These two laparoscopic procedures should not code along with some other laparoscopic procedure. Okay, that is the guideline here. All right. So keep in mind that. You will get it from the code book also. Anyway. Now let's move to second question. The second question. A 15-year-old female is to have a tonsillectomy performed for chronic tonsillitis and hypertrophied tonsils. So here the procedure is tonsillectomy. Okay. Maxillaire mouth gag was put in place and the tongue was depressed. The nasopharynx was digitalized. No significant adenoid tissue was felt. The tonsils were then removed bilaterally by dissection. The uvula was a huge size because of edema. A part of this was removed and the raw surface oversewn with 30 chromic catgut. Which CPT code should be used? So here the procedure carried out is tonsillectomy. So the remaining, from line 3, from sentence 3, it is just the procedure, how the procedure is being carried out. It mentioned, okay, like nasopharynx was digitalized, no significant adenoid tissue was felt, tonsils were then removed bilaterally. It's a bilateral procedure, okay, by dissection. All these are how the procedure carried out. So here you have to go for the tonsillectomy. tonsillectomy procedure. And then, is there any other procedure carried out? Part of, see, uvula was a huge size because of edema. So part of this was removed, means part of uvula was also removed. So that procedure also you have to code. Anyway, let's find out the correct CPT code. Go to the first code, 42821, first option. The first CPT code is 42821. Check what is 42821. Tonsillectomy and adenoidectomy, age 12 or over. Yeah, this is tonsillectomy, age 12 or over. This is age 15. Anyway, let's look into the other CPT codes as well. Keep it over there. What is the second one? 42825. 42825. Tonsillectomy, primary or secondary, younger than age 12. No, this is not younger. This is older than 12. So leave that. Now, what is 42826 in option C? Anyway, option B is wrong because code 42825 is wrong. What is option C? 42826. The same, tonsillectomy, primary or secondary, age 12 or over. Yeah, this is the same tonsillectomy, age 12 and over. This code we need, right? Now, what is 42106 in option C? 42106. 42106. What is 42106? Yeah, excision lesion of palate uvula with simple primary closure. Yes, 42106. Excision of uvula. That is also a part of the procedure, right? As I told you earlier. The uvula was a huge size because of edema. A part of this was removed and the raw surface was oversewn. Yeah, so this means a part of uvula is removed. So removed excision. That also you have to code. And this is a multiple procedure because both are separate procedure and two different procedures are carried out in the same surgical session. So you have to append it with the modifier 51. Okay. So that's why 42106 is appended with the modifier 51. If you want, you can go and check the option D also, 42842, just to confirm what it is. 42842 is radical resection of tonsillar pillars or retromolar trigone without closure. No, that's wrong. So here you got the correct answer as option C. See, in option A, 42821 is tonsillectomy and adenoidectomy. Here there is no adenoidectomy performed. Only the part of uvula was removed. So you can't say it as full adenoidectomy. So only tonsillectomy. So the correct code will be 42826 for tonsillectomy. Okay. So the correct answer here is option C, as discussed, 42826 for the tonsillectomy procedure and 42106 for the excision of uvula, part of excision of uvula, and append it with a modifier 51 since it's a multiple procedure. Okay. Now moving to the third question. A 65-year-old male patient with a history of carcinoma of the sigmoid colon is referred for a diagnostic colorectal cancer screening. So, diagnostic colorectal cancer screening is the procedure here. The patient completed all treatment for his cancer in ostick flex sigmoidoscopy exam to screen for recurrent colon cancer and examine the anatomic site. During the exam, the physician found 3 polyps in the rectosigmoid junction. They were removed by hot biopsy forceps. The path report indicated the polyps were benign. Code the encounter. Okay. So here you have to find out the code for diagnostic colorectal cancer screening. This is very, very easy to find out. Go to the first CPT code. Option A, 45333. See, all are similar codes. 45333, 45331, 45338, 45330. So let's find out what it is. So, how the procedure is carried out here? Check the second line. The patient completed all treatment for his cancer in ostick flex sigmoidoscopy exam to screen for recurrent colon cancer. So, how the colon cancer was screened? By doing sigmoidoscopy examination. So sigmoidoscopy is the procedure code that you have to code it. Okay. So anyway, go to the first, go to the options. 45333, 45331, 45330, 45338. All are there. So which is the smaller one? 45330. Let's start with that. Anyway, the others are the continuation of 45330. If you can see the CPT code book, we can check the CPT code book. 45330 is the starting one. The remaining are just part of that CPT code. So 45330 is sigmoidoscopy flexible diagnostic including collection of specimen by brushing or washing when performed. Now, what is 45331? The same sigmoidoscopy with biopsy, single or multiple. Here, biopsy, they were removed by hot biopsy forceps. Let's see. Biopsy is there, but it is done by hot biopsy forceps. Let's find out if there is any perfect, any accurate code. What is 45331? We checked. 330 we checked. Now 45333. Yeah, 45333. Again same sigmoidoscopy flexible with removal of tumor, polyp or other lesions by hot biopsy forceps. See, we got the exact CPT code, the exact description. Hot biopsy forceps 45333. If you want, you can check the one more code 45338. Again, with the removal of tumor, polyp or other lesions by snare technique. No, this is not snare technique. This is hot biopsy forceps. The procedure carried out by hot biopsy forceps. So here the correct answer is CPT code 45333. Answer is option A, 45333. Sigmoidoscopy flexible with removal of tumor, polyp or other lesions by hot biopsy forceps. Okay, this is how you need to find the answer, the accurate answer. Now let's go to the fourth question. A 52-year-old patient is admitted to the hospital for chronic cholecystitis, for which a laparoscopic cholecystectomy will be performed. So here laparoscopic cholecystectomy is the procedure. If you want, you can mark it with the pencil when you do the examination. The important points you can mark it, underline it with pencil. Later you can erase it if you have time. Otherwise also that's fine, leave it. So you can mark it with the pencil. So laparoscopic cholecystectomy. Yeah, a transverse infraumbilical incision was made sharply, dissecting to the subcutaneous tissue down to the fascia using access under direct vision with a vesiport and a scope was placed into the abdomen. 3 other ports were inserted under direct vision. The fundus of the gallbladder was grasped through the lateral port, where multiple adhesions to the gallbladder were taken down sharply and bluntly. The gallbladder appeared chronically inflamed. Dissection was carried out. To the right of this, identifying a small cystic duct and artery was clipped twice proximally, once distally, and transected. The gallbladder was then taken down from the bed using electrocautery, delivering it into an endo bag and removing it from the abdominal cavity with the umbilical port. What CPT codes should be reported? So here the procedure carried out is laparoscopic cholecystectomy. And how the procedure is carried out, that is the description mentioned there. Okay, so let's find out the CPT codes. Okay, let's directly go to the options and then find out what exactly it is. What is option A? 47564. What is 47564? 7564. Yeah, laparoscopy surgical cholecystectomy with exploration of common duct. If you read the question again, once again, you can identify what should be the exact code. Is there any word that, or is there anything that represents the exploration of common duct? No, nothing is mentioned. Okay. What is 47562? Option B. 47562, laparoscopy surgical cholecystectomy. Yes, of course, that is what the procedure is carried out here. Still, we will find out, we will check the other two codes, the other two options to see if there is any accurate CPT code. Okay. 47610 option C. 47610, it's just mentioned cholecystectomy with exploration of common duct. One thing, there is no exploration of common duct, and also this is not a simple cholecystectomy, this is a laparoscopic cholecystectomy. So that option is also wrong. 47600, option D 47600 also just mentioned cholecystectomy, so that's also wrong. So you got the correct answer as option B, right? Option B 47562, laparoscopy surgical cholecystectomy. That is the answer among these four options, the correct answer. Okay. See, this is how the question looks big, and so you might think, oh, I will take so much of time to read it out, to understand the question, and then finding out the answer. It will take more than 10 minutes. Don't think like that. The question might be hard, the question might be long, but the answer will be simple. Okay, you directly go to those who are preparing for the examination. I am telling you, if you are getting such type of questions, go directly to the options. Read. You should always read out the question at least once, because while reading, some points it will be clicked in your mind, right? And as I told you earlier, you can underline the important points or the important service, that if it is only CPT code, underline and the service what is carried out while reading out the question itself. If there is some ICD code also mentioned in the question, you have to go for the diagnosis also. What is the diagnosis here? Chronic cholecystitis. That is the diagnosis here. So, for example, cystitis code, chronic cystitis, cholecystitis diagnosis is mentioned, then you have to mark that also. Okay, to find out the answer. So, so like that you can, you will get easily the answer. You can easily score point for this question. Okay, such type of questions. So, go directly to the options. Read the question once, understand, mark important points. While reading itself, mark important points. Then go directly to the options. Even though you got the correct answer from option A or B, don't skip the other two codes, because sometimes, as in our third question, sometimes there will be more accurate answer, more accurate CPT code. So go and read all the options. Okay. So anyway, here our correct answer is option B 47562, laparoscopic cholecystectomy. Okay. So let's move to one more question, fifth question. A patient with rectal bleeding undergoes a proctosigmoidoscopy. Yeah, so what is the procedure here? Proctosigmoidoscopy. Underline that. During the proctosigmoidoscopy, the physician identifies internal hemorrhoids. So while doing the procedure, proctosigmoidoscopy, the physician identifies that the patient is having internal hemorrhoids. Okay. The proctoscope was withdrawn and the anus was prepped and draped. A field block with margin 0.25% was then placed. Anoscope was inserted. There was a prolapsing hemorrhoid in the anterior midline. This was rubber band ligated by applying 2 bands. In the posterior midline, there was another hemorrhoid that was banded in the same manner. What CPT codes are reported? So here you have to code for proctosigmoidoscopy and then the code for internal hemorrhoids. Okay, you understood these two, right? Now let's go directly to the codes. Let's find out the answer for the CPT codes. What is the first one? 46221. Option A, 46221. Check what it is. 46221 is hemorrhoidectomy internal by rubber band ligation. Yeah, this is hemorrhoidectomy because internal hemorrhoids, the physician identifies internal hemorrhoids, right? So hemorrhoidectomy also performed. This can be, this code is needed. Still go and check the other codes. What is the second code? In same option, second code 45300. What is 45300? 45300. 45300 is proctosigmoidoscopy, rigid diagnostic with or without collection of specimen by brushing or washing. Separate procedure. Yes, the same one. Proctosigmoidoscopy procedure is also conducted. Since this is a multiple procedure, append it with modifier 51. This is also right. Now what is the third CPT code in the same option? 46600. 46600. Anoscopy diagnostic including collection of specimen by brushing or washing when performed. And it is marked with the modifier 51 in the option. But anoscopy, since the code 46221 is present, which is hemorrhoidectomy internal by rubber band ligation, no need to add again anoscopy procedure because it is the same. Anoscopy, what is there? Anoscope was inserted, anoscopy procedure, that is for the internal hemorrhoids. So that we already marked as 46221. So no need to add 46600 again. So because those two are bundled codes, you can't code both together. Okay. So skip that option. That option is wrong. Now if you check option B, the same 46221, 45300 with modifier 51. Yes, this much only we need, right? The one for internal hemorrhoids code, hemorrhoidectomy, and the second one is proctosigmoidoscopy. So we hope that B could be the answer. Just keep it over there. Check the other codes as well in option C and D. Anyway, in options C and D, proctosigmoidoscopy procedure is the same. For the code is same 45300. What is the other one? 46945 in option C. 46945. 46945. What is 46945? Let me check. 46945 is hemorrhoidectomy internal by ligation other than rubber band. Single hemorrhoid. No, this is rubber band ligation because it's mentioned there in the question, almost second last line. This was rubber band ligated by applying 2 bands. So it means it's a rubber band ligation. So all this, when you read the question, you have to underline. Okay, rubber band ligation. So 46945 is the incorrect code. Now if you check option D, 45300, that is the code for proctosigmoidoscopy, and 46600 anoscopy, both are marked with modifier 51. No, for multiple procedure, use the first code and then the second code you have to mark with modifier 51 for multiple procedures. Okay, because we won't append modifier 51 to both the CPT codes. First one should be single without any modifier, and then second code procedure you have to mark with modifier 51. So the correct answer here will be option B, 46221. And there is one specification for this code, 46221 code. This code, this is the word is 46221, hemorrhoidectomy internal by rubber band ligation. Okay, so 46221, this code you have to code only once per operative session. Per operative session, this code should be used only once. Okay, so 46221, so answer will be option B, 46221 for the hemorrhoidectomy, along with proctosigmoidoscopy code 45300, and append it with a modifier 51 to represent that this is a multiple procedure. So answer is option B. Okay. So these are few important questions. Hope you understood. If you find this video useful, please like and share among your friends. And those who are new to the channel, please support me by subscribing to the channel. So if you have any queries, any comments, please mark it. Please mention it in the comments. And as soon as possible, I'll be getting back to you soon. Okay. So thank you so much, friends. Thank you so much for all of your support. So stay tuned for more videos and more questions. I'll be coming back again in the coming week with more and more mock and practice questions. So stay tuned, friends. Thank you so much. Bye. Take care.